Well, with me now is Doctor and former Labour Health Minister Lord Owen, who is urging his fellow crossbench peers to scrutinise and amend the bill when it comes before them on Tuesday. How much concern is there in the House of Lords?
I think a lot. I think many people are very worried about this bill. Personally, I believe if this bill was to be introduced in 10 years' time, the NHS would be unrecognisable. It's far more far-reaching than people understand. And it's a great sadness to me personally. I think the NHS stands for some ethical and altruistic elements in society. It's extraordinary, really. David Cameron, who promised us no major reorganisation during the election, has put his name to the biggest reorganisation of the health service from the top down that there's ever been since 1948.
So what are you trying to achieve?
I can only hope to improve the bill. We can't wreck it. We can't vote against it. We're a revising chamber. The House of Commons is unelected, appointed chamber.
You mean you shouldn't vote it down, you mean? Or, I mean,
well,
because you
could. Technically, I don't think you could. Certainly the votes aren't there. I understand why Labour feels very frustrated and angry about it. But nevertheless, as a crossbencher, all I'm going to do is to try to improve the bill. That's all I can do. I think a select committee can look at the powers of the Secretary of State for Health and the duties. At the moment, he's abdicating from practically every power. There are very few parliamentary controls, constitutional issues have been set aside. This needs to be looked in the round by a group of experienced parliamentarians in the House of Lords coming back with amendments worked out that could, I think, restore some of the necessary powers for the Secretary of State.
But hasn't there just been a massive review of this bill?
That was a very doctor-orientated. That was done at the forum. I think it did make some useful changes. I mean, the mere fact that the bill had to go in for a great pause, they had to revamp great sections of it. But the fundamentals have not really changed. What we can do in the House of Lords is say the NHS is a ration service. It's always been. One of the reasons it's acceptable, and we don't pay anywhere near as much as many other countries for it, is that it is overall understood to be under democratic control. There is answerability, and people have to look to Parliament, and by and large, Parliament has protected the National Health Service.
So your fear here is that the Health Secretary will no longer be responsible for delivering health in England?
No, he's deliberately taking himself out of the responsibility to secure a comprehensive health service. He says he'll promote it.
So it'll be blame the GPs, basically, if things go wrong?
Yes, there's a lot of other people will be down there. It is privatisation. People say it's not, but it effectively will mean that there will be a commercialisation of health service, and the values will be that of the market. Now, we've had an internal market for some years. This is a straight-out external market. But the most important thing that the House of Lords can do is restore parliamentary authority, some safeguard. If there's a failure in the health service, then when people want to turn to Parliament, we don't have a Secretary of State who says he can't do anything about it.
Lord Owen, thank you very much.